Welcome back to the Delaware Way. I'm Larry Menti. When you think of doctors, when you think of hospitals and medicine, you probably think about your well-being, but it's just as important to the well-being of a state when it comes to the economic benefits. Dr. Nancy Phan is with the Medical Society of Delaware. Thank you so much for being here. So how much money does medicine, do doctors bring into the state of Delaware?
So the last estimate from the survey, the Economic Impact Survey that was put out by the American Medical Association, $4.8 billion.
How does that compare? Do you know how much that compares to other industries?
So compared to other industries, the one that we compare ourselves to would be the legal industry, home health industry, and generally speaking, we're pretty comparable. We bring in more as far as jobs, output, wages, tax revenues.
How many jobs?
So for every one physician, we create 11 to 12 jobs.
I think I saw a number. It was over 25,000 jobs.
Yes, for the state of Delaware. Yes, you're right. Correct.
It was over 25,000 jobs, which is significant.
It is a significant impact.
That, I would think, and you tell me if this is correct or not, because maybe this is flawed thinking. With an aging population, there's going to be more doctors and more demands for medicine. Is that right?
You would think so. Yes, absolutely.
And is that playing out?
Well, in Delaware, it's difficult. Primary care physicians, which is the group of physicians who would be the primary people taking care of older patients, is the lowest number of physicians as far as Delaware is concerned. They bring the most jobs. They actually have the most economic impact, but they are the ones suffering the greatest shortage.
Right, but I understand that. But then for every doctor that I used to go to, I have a Minute Clinic, or I have the CVS now having nurse practitioners there. It seems like we've expanded beyond the offices that we used to think about.
So this survey actually does look at that. It looks at both what's an office-based practice as well as what we call outside of the office practices. So it does incorporate some of what you're referring to, but it is all about what the physicians bring in. When you have physicians in your state, you're going to have a greater economic benefit from having the physicians in the state.
Why is this important? I mean, this survey was done by the Medical Society of Delaware?
This survey was done by the American Medical Association, and they broke it down by each state. So there's one for each state as well as D.C.
Okay. Why are these numbers important, do you think, for doctors, for the medical profession?
Well, I think it's not really for the medical profession. I mean, it's nice for me to know that I help bring more to the state than just the well-being of my patients. I mean, we provide great quality of care. But I think what's important is to look at, if this is what we're bringing to the state, how does this help the rest of the state? Like, for example, if we're talking about tax revenues, we brought in $165 million in tax revenues.
I know, it sounds to me like it was put together for lobbying efforts.
No,
it sounds to me like it's almost you saying, look, do you know the importance of us? We need this.
Well, so we compared ourselves to, like I said, other industries that you mentioned, you know, like the legal, home health care, nursing, higher education. And so what we're trying to say is don't discount the other values that medicine or medical physicians actually bring, and recognizing that when there's a shortage, that not only is it just affecting the health of a Delawarean, but it's also got a broader impact.
Yeah, and when I say lobbying, that's not always bad. I actually wish there was more lobbyists for the medical profession, because the lawyers do such a good job at it. I wish there were some for doctors as well. I want to get quickly to this website that's going to have a health scorecard for Delaware. What is that all about?
So the state, and through the Healthcare Commission, which I happen to be the chair of, is putting out a website for public information about how the health of the state is through a scorecard. So as physicians, we're very comfortable with scorecards. You have certain values on the scorecard. You get measured according to a certain comparison. And so we want people to start realizing, well, this is how our health is being measured. Where are we? How can we improve that? Where do we spend our money? And maybe that can actually help us lift ourselves out of some of the not so good numbers we have and some of the health that we actually have.
So for instance, if not enough money is being spent on preventative care, that would be a problem. If you had problems down the line, that I don't want to be so elementary, but you can say, oh, we need to spend more money in elementary care. We need to put more resources into this.
No, I think that's an excellent way to look at it. On top of which, we truly believe that when the public is better educated, they're going to make good health choices, and they're also going to help us figure out where the money should go.
Great, thank you.
Thank
I
you
really
very
appreciate
much.
you being here, Dr. Nancy Phan from the Medical Society of Delaware. When we come back, a look at Black History Month in Delaware when the Delaware Way continues.